Mr. President, I rise to speak in morning business. I listened carefully to the statement just made by the Republican Senate leader, Senator McConnell of Kentucky, in which he promised concrete ideas, real hope, change, job-related approaches, free enterprise, giving free enterprise a chance, trying to deal with putting America back to work. And then he gave us three examples. And I might say to the senator that I'm familiar with all three because none of these are new. We've heard them over and over again from the Republican side of the aisle. I won't go through each one of them. A couple of them relate to the Affordable Care Act. It is interesting to me, the House of Representatives has voted, I believe, 45 times to repeal the Affordable Care Act. The senator from Kentucky said we've got to get back to free enterprise ideas. Let me tell you a free enterprise idea when it came to health care. Before the passage of the Affordable Care Act, the free enterprise idea was this. If you were unfortunate enough in your family to have a sick baby, if your wife was a cancer survivor, if your child had diabetes, the free enterprise answer was, we will raise the cost of health insurance to the point you can't afford it, or we won't even offer it. That was the free enterprise idea on health insurance for millions of American families. There was another free enterprise idea out there in health care as well. It said, we're going to sell you health insurance policies that just protect you up to a certain amount of money. And if tomorrow you're in a terrible auto accident, if the day after tomorrow you're diagnosed with cancer and face millions of dollars of radiation, surgery, care before you can get your life back together again, be my guest to pay for it yourself. That's why medical bills were the #1 driver of bankruptcy in America today. That was free enterprise at work. What we said, let's put some sensible rules of the road in here so that families that buy health insurance have the promise that they'll have peace of mind when they face these life-threatening struggles, which families face every day. So we passed the Affordable Care Act, and not a single Republican, not one, not a single Republican would join us in that effort. We rejected the free enterprise approach to health care and said, let's have something that basically respects families, basically respects the needs we all have to have protection when somebody in our house is sick. Not a single Republican would support us, and they never have since. The bill we passed isn't perfect. Changes will have to be made. I've said that from the start, though I support it. But not a single Republican's been willing to sit down and work on bipartisan compromises and changes, not one. It's take it or leave it, and they want to walk away from it. We're not going back to those old days. I can just guarantee them the American people will never return to their idea of health insurance because it was fundamentally unfair, it was too expensive, and a lot of Americans didn't have a fighting chance to ever have health insurance once in their lives. Things have changed. The reports are in, and the reports are telling us that dramatic things are occurring. As the Affordable Care Act's initial enrollment period closes, at least 9.5 million previously uninsured people have gained coverage. Some have done so through the marketplaces created by law, some through private insurance, others through Medicaid. That's been expanded, incidentally, Medicaid in about half of the states. Listen to this. The increased coverage from the Affordable Care Act so far amounts to substantial progress toward one of the law's principal goals. Listen, it is the most significant expansion of health care coverage since the creation of Medicare and Medicaid 49 years ago. The Republicans want to return to the good old days, and they want to tell these people being uninsured is really better for you. It's the free enterprise system. Not good enough, I say to my friends on the other side of the aisle. What we have here is an opportunity for families for the first time in their lives to have health insurance coverage. Have you ever been at a moment in your life where you have a sick baby and you're in a hospital waiting room and you have no health insurance? I have. It happened when I was in law school. I remember it to this day, sitting there with my wife and baby with a number in my hand, waiting to see who would walk through that door and be the doctor for my baby. You'll never forget that as long as you live. That shouldn't happen to anybody. Everyone should have the peace of mind of health insurance coverage, and that's what this bill does. And if the senators on the other side want to return to the, quote, good old days of no coverage, I can just tell you America is not going back. We are not going back to the days when families with kids graduating from college had no health insurance while they looked for a job. We protect those families until the kids reach the age of 26. We are not going back to the days when struggling senior citizens can't afford to pay for their prescription drugs because of the so-called donut hole. We're not going back to that day. We're going to move forward as a nation. Is this bill perfect? Of course not. Should it be changed for the better? Yes. But let's not lose sight of what we have achieved and what we can achieve if we work together. I want to make point two when it comes to this whole question of affordable care. I happened to meet a man who was Ray Romanowski, and he was at a healthcare clinic in Chicago. Ray's 62 years old. He's been a part-time worker, musician most of his life. Ray Romanowski, for the first time in his life, has health insurance. He has a Medicaid card. He was patting his wallet, and he said, I can't tell you how good I feel that I finally got this health insurance. There are some people who don't understand Medicaid. Medicaid is health insurance for low-income people in America, and millions depend on it every single day. Recently, some Republicans made statements discrediting the Medicaid program. Let me set the record straight. Medicaid is successful. It's been a lifeline for millions of people, especially for children. My friends on the other side of the aisle find it easy to discredit a government program. As Senator McConnell said earlier, we tend to look to government. Well, we do when there's no place else to look. And in this case, these individuals had no chance for health insurance without the government's help. Over 54 million people benefit from Medicaid, and it's not surprising that interest in this program grows when our economy is struggling. Before the Affordable Care Act, 2 out of 3 people on Medicaid were pregnant women and children, 36 million of our most vulnerable citizens. Medicaid also serves the disabled. It's been a lifeline for low-income disabled. Before the Affordable Care Act, almost 3 million people were covered by Medicaid in Illinois, and over 50% of all births were covered by Medicaid. Since the Affordable Care Act was signed into law, over 210,000 people in Illinois have signed up for Medicaid. Thousands more are eligible in the process of finishing their paperwork. That's a success. According to 2011 data, 65% of all the office-based physicians in Illinois would take Medicaid patients. Nationwide, the number is 70%. This argument that new Medicaid patients won't have a place to go for care is just wrong. I see Senator Harkins on the floor here from Iowa, chairman of our HELP committee. He was one of the real leaders when it came to the determination of the Affordable Care Act and how many people would be covered. I'm going to yield the floor to him in just 1 minute. But let me say this. The Affordable Care Act is making a difference. And for people in low-income categories, Medicaid means that when they walk into the hospital now, facing a medical emergency or a need for care, they're not going to walk away leaving bills behind them. Their bills will be paid by the Medicaid system. That is part of what we're trying to achieve. The personal responsibility that every person, every family, every business will have a responsibility to have health insurance and an opportunity for an affordable alternative. The free enterprise system is a strong system. The free enterprise system created unfairness and injustice when it came to health care, which we are addressing with this Affordable Care Act.